Morning everyone. So up to now we have seen regarding the fertilization process and then the male reproductive system, female reproductive system, spermatogenesis process, extras, and today we will see regarding the pregnancy process. What is the pregnancy process and what are the changes that are going to occur during pregnancy process in a human body. During weeks of the fertilization, the sperm will join with the egg to form a zygote. Therefore, the blastocyst will form and they will rotate around the uterus. So, there is low ratio of release of estrogen and progesterone. See, the blastocyst contain inner cells. These inner cells becomes fetus. And it also contains outer cells. These outer cells are called as trophoblast, which becomes fetal placenta. And this produces human chorionic gonadotropic hormone, which is responsible in detecting the pregnancy. In the first trimester of 1 to 13 weeks, the corpus luteum, the placenta, it will produce hormones like estrogen, progesterone, HCG and human placental lactogen. This human placental lactogen is mainly the use of this human placental lactogen is it makes the glucose available to the fetus. So the first change which occurs is the change in the uterus length. The uterus, the top portion of the uterus is known as fundus, and you can see the height of the fundus in the first 20 weeks the umbilicus will be 20 centimeters and in the 36 weeks it will reach to 36 centimeters. The change is cardiovascular system will expand according to the uterine changes. The high volume state, the blood volume will increase up to 30 to 50% in a pregnancy state. From 5 liters to it will increase to 7.5 liters of the RBC, and plasma also increases a lot. So when the cardiovascular rate increases, it also increases the heart rate and it increases the cardiac output of the heart to reach the blood to the vessels, and it also causes mild hypertrophy when in the pregnancy time, and this mild hypertrophy will be relieved after the pregnancy. It means nothing but increase in the heartbeat. Uterus increases in length, it presses the pelvic veins. When it presses the pelvic veins, it causes the swelling of the veins and it causes the swelling of lower legs and ankles, which commonly occur in pregnancy time. Down, the uterus presses the inferior vena cava. When it presses the inferior vena cava, then the less blood reaches the right atrium. When a less blood reaches the right atrium, it may cause hypotension. A side lying position is very helpful for the pregnant woman with a pillow. Change which occurs in kidneys is in kidneys it increases the blood flow. When the blood flow is increased, it increases the glomerular filtration rate and urinary output. Then it causes more urinary frequency. That's why a pregnant woman more frequently urinate. Change is in lungs. The uterus, as the increase in uterus, it presses the diaphragm. When it presses the diaphragm, then it takes hard to breathe. When it compared with the normal stage, in the pregnancy stage, it takes harder to breathe comfortably. Progesterone hormone relaxes the ligaments and the thoracic region, so what it does is it increases the tidal volume of the lungs. Increased estrogen levels may increase the vascularization in the lungs and it causes problems like nasal stuffiness, sinus congestion and nosebleeds. These are the most common problems during the pregnancy because of the estrogen levels. Once the placenta releases the progesterone and relaxin hormones, what it will do is it will loosen the bones and it causes the pain in the ribs and coccygeal bone, that is known as tailbone. The next change will occur in gastrointestinal tract. Here the hormonal changes will cause a smooth muscle relaxation and then it decreases the peristaltic movement in GIT, so it causes the constipation and bloating problems, and it may cause the gastric reflux and heartburn due to the lower esophageal sphincter relaxation, and it may also cause changes in the taste. In brain, the changes will cause the estrogen and progesterone levels will cause irritability, that is irritation, anxiety and depression in a human body due to pregnancy. Hormonal increased levels will also cause the breast development and it also causes some problems in the breast, that is tingling sensation in the breast and fullness of the breast, and it also causes tenderness in the breast. Anterior pituitary produces melanocyte stimulating hormone which causes areola darkens of the breast. It darkens the areola of the breast. Thyroid gland, it may affect the thyroid hormone secretion, then it causes the increased cellular basal rate. Estrogen levels will also cause and it promotes the blood clotting.